How is a bone biopsy performed to detect cancer? Imagine trying to find a tiny clue that could reveal if a bone tumor is cancerous. That's exactly what a bone biopsy does. It's a procedure where doctors take a small piece of bone tissue to look for abnormal or cancer cells under a microscope. This step is crucial in diagnosing malignant bone tumors like osteosarcoma, chondrosarcoma, or Ewing sarcoma. The process starts with imaging tests such as X-rays, computed tomography scans, or magnetic resonance imaging. These images help doctors pinpoint the exact spot in the bone that looks suspicious or active. Sometimes, more advanced scans like positron emission tomography combined with CORT or MRI are used to find areas with high metabolic activity, which often indicates cancer. Once the target area is identified, the patient is positioned comfortably so the doctor can access the site easily. The skin over the area is cleaned thoroughly, and a local anesthetic is injected to numb the skin and surrounding tissues. If the biopsy is expected to be more complex, or if the patient is a child, sedation or general anesthesia might be used to keep the patient comfortable during the procedure. Next, a small incision is made in the skin. A special needle, guided by real-time imaging such as CORT or ultrasound, is inserted through the incision into the bone. The doctor carefully pushes and twists the needle into the bone to collect a tiny sample of tissue. Sometimes, a drill-like system is used to obtain a larger or more representative sample, especially if the bone is very dense or hard. After the sample is collected, the needle is gently removed, and pressure is applied to the site to stop any bleeding. The area is then covered with a bandage, and stitches are usually not needed. The tissue sample is sent to a laboratory where a pathologist examines it under a microscope to check for cancer cells. The entire procedure typically takes about 30 to 60 minutes and is often performed on an outpatient basis, meaning the patient can go home the same day. After the biopsy, some soreness or tenderness in the area is common for a few days, but serious complications are rare. A bone biopsy provides a definitive diagnosis of whether a bone tumor is malignant. It helps determine the type of cancer, its grade, and whether it has spread to other parts of the body. This information is vital for planning the best treatment options, which may include surgery, chemotherapy, or radiation therapy. From the perspective of bone cancer, a biopsy is an essential step to confirm the presence of cancer cells and guide treatment decisions. It is a safe, effective, and standard procedure used worldwide to diagnose bone tumors accurately. Always remember, if you or someone you know is facing this, consulting a healthcare professional is the best way to get personalized advice and care.